This is a case of a patient suffering from pressure spikes during dialysis. Since his IOP was very high, we opted for a valve tube instead of a non-valve tube since it would work immediately. However, to reduce the risk of excessive encapsulation, we opted to perform a partial tube ligation in order to constrict the lumen of the tube and reduce the amount of aqueous going over the plate, which is a technique that Dr. Mary Q learned about from her former colleague, Dr. Mats Medard. In addition, we chose to fenestrate the tube to enhance early outflow to the subconjunctival space since we partially ligated the tube. We plan to leave the AC full of healing in the end in order to dampen the magnitude of the IOP drop. Start by marking the area of the peritomy. The conjunctiva was open in the superior quadrant. An AMID FP7 was prepared using a 6-0 proline and ligating with a 7-0 Vicryl. The proline was removed. The tube was primed using BSS, and the plate was sutured to the sclera in its usual fashion. A 23-gauge needle was used to create a non-tunneling sclerotomy into the ciliary sulcus. A 3-0 proline suture was inserted into a paracentesis on the opposite side and into the needle and out of the sclerotomy. The tube was then inserted using the proline suture as a guide wire. The proline suture was removed. A scleral pseudoplast was sutured overlying the tube insertion site with 7-0 Vicryl to reduce the risk of tube erosion. Conjunctiva was reapproximated using two wing and interrupted sutures along the relaxing incisions. It was closed using chromic cut. 40 milligrams of Kenalog was injected over the end plate to reduce plate encapsulation. An antibiotic was given in the subconjunctival space. The AC was left full of Elon. The patient's IOP in both eyes has remained around 10 on zero glaucoma medications. He had self-limited choroidal effusion in both eyes, which resolved by post-op month 1, and he has not reported any more blurry vision or pain during dialysis. Thank you for watching our video. We hope you will consider performing a partial tube ligation with or without concurrent fenestrations when using the AMED glaucoma valve, which may help reduce the risk of end plate encapsulation. Canalog over the plate can also be helpful, and the AC can be left full of Helon to dampen the magnitude of immediate IOP lowering. Please email us if you have any questions.